Alrighty. So welcome everyone to our first alumni forum with Dean Sarah Gehlert. This is a great opportunity for everyone to get to know our new dean. My name is Amanda Decker, and I am the Senior Development Officer for Constituent Relations and Advancement Operations here at the school. I oversee alumni relations and professional development as part of my job. So we're very excited today to have this conversation with Dean Gehlert. I'm joined today by Kristina Chatow, a 2002 graduate of our program, and she also serves as our representative for the school on the Alumni Association's Board of Governors. So welcome today, Kristina. And I'm also joined by our Dean, Sarah Gehlert, who joined in April. So Dr. Gehlert comes to USC after having served as Dean, most recently for the College of Social Work at the University of South Carolina, the University of South Carolina Educational Foundation Distinguished Professor. And then prior to South Carolina, she served as the E. Desmond Lee Endowed Professor of Racial and Ethnic Diversity in St. Louis, where she was the co-program leader of the Prevention and Control Program of the Siteman Cancer Center, Associate Director of the Transdisciplinary Center of Energetics and Cancer, Training Program Director of the Program of the Elimination of Cancer Disparities, and co-chair of the Center for Community Engaged Research Institute for Clinical and Translational Sciences. So welcome, Dean Gehlert, and Kristina, I'm going to let you take the things away.
Thank you, Amanda. Thank you for that introduction. Thank you to the alumni for being here today. I am very excited to be here to be interviewing Dean Sarah Gehlert on behalf of our alumni. Dean Gehlert, I'm very much looking forward to our conversation today. I know Amanda gave me a brief intro, and I'd just like to share a little bit about my USC journey. It started back in 1996 with my undergrad, and I graduated in 2000. I then went on to get my MSW 20 years ago. I can't believe it. 20 years ago, I started my MSW program at USC. I started my first year internship at a nonprofit where I had amazing supervision and instruction, and where I later continued and worked there for about 7 years. I eventually got my LCSW, and about 12 years ago, I transitioned to a more non-traditional social work role. So even though I wasn't practicing direct social work, I was still practicing those social work skills in a business setting. So about a year ago, I sold my business, and now I am involved with impact giving. I'm involved with a group of women where I am able to give collaboratively to other nonprofits. So 20 years later, I'm back here at USC interviewing our new dean, and I'm also back involved with nonprofits. So that's just a little bit of my background and my USC journey. And I have to say, Dean Gehlert, I'm so looking forward to our conversation today.
Thank you, Kristina. It's great to have this opportunity, and I have to thank Amanda and Kristina. Kristina's energy is infectious. We've been having a lot of fun talking.
We have, and I have to say, even last week we were able to talk and get to know each other better, and I was able to get a better feel for you and your background as well. So I'm very much looking forward to our conversation today. I have to say, it was so interesting for me to hear about your background and how you have your bachelor's and your master's degree in anthropology. And I think part of this conversation today is just us getting to know you better. And maybe you could share with us about your background there and how you transitioned to social work and to getting your MSW.
Sure, I'd be happy to. So I began my career as an anthropologist, and I was looking at how the interaction between biology and the social environment. I worked at archaeological sites, and we were trying to reconstruct the social life, how things were 8,000 years ago from what we found. So I was on the coast of Peru. It was my doctoral dissertation work. And I sort of had an epiphany while I was doing my work because I was deeply affected by what was happening back in the United States. This is a long time ago. We won't talk years. You can talk 20. I could talk more, but we won't. So I was deeply affected by poverty rates that were deepening and social unrest after the war in Vietnam. And I knew that what I was doing, working with mummies and bones, it was cool. And it ultimately would have some scientific value. But I really wanted to do something that would make social change more immediately. So I went back to the university and I visited the School of Social Work to see if I might fit in. I knew nothing about social work whatsoever. I just liked the word social. And that was it. I just fell in love with social work for a lot of reasons, not the least of which is that social work education was a lot more diverse than anthropology in terms of the workforce. I just felt at home. So I got my MSW and I practiced for 7 years as a health social worker in women's health, pediatrics, neurology, and I worked in the emergency department and neonatal intensive care unit. That kind of shaped who I was. And I was on the city's sexual assault task force connected with the work in the emergency department. But then I wanted to go back to research to learn how to use research to influence health policy and practice, because I had been, doing research in anthropology and I was working as a social worker, but I really was frustrated at my lack of ability to change policies and practices. So I thought maybe I could put the two things together. And I was admitted to the doctoral program at Washington University. Hearing other.
Sorry, that wasn't me. That wasn't me, sorry.
It wasn't a question. So I was able to get through the doctoral program, and I was lucky enough to get my first position in the School of Social Service Administration at the University of Chicago. Amanda alluded to that. I had joint appointments in the Department of Comparative Human Development and the Institute for Mind and Biology, and I loved it. And I was able to be involved with the med school quite a bit. And I led, as Amanda said, the Center for Interdisciplinary Health Disparities Research, which is kind of hard to say. But that was important really because I led a team as the principal investigator of biological, clinical, social, and behavioral scientists, and with a lot of community members involved. And I developed a deep interest in team science, how to make teams work, and also community-based participatory research. And at the same time, I was SSA's Deputy Dean for Research. So these things are layering. And then in 2009, my dean at Chicago, Eddie Lawler, moved to be dean at WashU. And he brought me there as the professor of racial and ethnic diversity. And I was honored by that because Larry Davis, who founded the Race Center at Pittsburgh, asked that I be given the chair that was created for him when he left in racial and ethnic diversity. So that was, to me, a big honor. And I also was lucky enough to be made a professor of surgery because I worked at the cancer center, and my husband was scared to death of that. He thought, oh no, she's gonna think she's a surgeon, But it was nice. So those cross ties, I think, are important. And it's really important for other disciplines and professions to know what social workers do.
Well, and it's so interesting what you said. There was a point when you decided to get your MSW to pursue social work. It's like it clicked for you. And I feel like that's what it has done. I know for myself, when I decided to pursue the MSW, and I'm sure for so many social workers as well. I know you were back at South Carolina, University, the other SC, and now you are here at USC. And I'm sure people have welcomed you to the Trojan family. Welcome to USC. And I mean, what was it that attracted you to the role of dean of this USC Suzanne Dworak-Peck School of Social Work and Department of Nursing? Why here and why now?
Well, there are a couple reasons. Right now, I think that you know, as there's so many physical constraints, people are really questioning social work, and it's, and at the same time, maybe don't completely understand its value. And this school, the Suzanne Dworak-Peck School of Social Work, is the largest in the world, if I'm not mistaken. And it's always been so strong. You know, you can sort of argue about the dates, but we can say it's 100 years old, I think, safely. And I've seen across the country schools of social work being merged with other disciplines and departments. Even at Washington University, my alma mater, they brought public health under the umbrella of social work. And we see at many schools people being made deans and directors who aren't social workers. And, you know, sometimes that's fine. This might be someone who's worked in a school of social work for a very long time. But lately, you know, deans have been named who really didn't know very much about social work. So I saw it as an opportunity to really make a great school even greater.
Thank you.
And that's why also.
Yeah. And if you could share a little bit, I mean, I know you touched on it in the beginning, but specific experiences that you've had in your career that have prepared you for this role, because it is a, you know, coming out to USC into this new role.
Yes. I think that I sort of drank the Kool-Aid of team science. And
Okay.
Every year I'm in social work, I love social work more.
Mm-hmm.
So, and again, I think that we'll probably get to this, but Suzanne Dworak-Peck School could be a little bit better known around the country. I think that's something I'd like to work on. But when I looked at the statement, you know, I really wasn't interested in moving. I'd already retired once. I was a total failure at retirement. But it said that in the statement, the school is poised to enter a new period focusing on its core mission, and the new dean will have the opportunity to lead the school through this transition into a new era of academic excellence and fiscal responsibility. And being able to do that, the prospect of doing that in an environment that clearly saw that as a goal really attracted me. I saw it as building on a school that's already known for its innovation, and expanding the mission to just really better package the school and help it achieve even greater impact.
Well, we are happy that you're here. It's true. And I mean, coming here now, I know you were supposed to move out here in April, and then with the pandemic, you're now out here. You came out in July, but you have come to USC at an unprecedented time. You know, during a time when we are dealing with a global pandemic that none of us have ever seen before, and a civil rights movement as well. And I'm just wondering, how are you responding to these current challenges?
It's not the easiest thing I've ever done,
Right.
I'll say that, which was kind of an understatement. But at the
Yes.
same time, I like to see challenges as opportunities for getting better. And I think it's caused us to really think about our curriculum and how we deliver it. So we've had a lot of pretty in-depth conversations about how best to configure the curriculum, especially how best to deliver it. And I think that the model that we're going to use in the fall is really pretty strong, and we'll learn from it. It's not, the New York Times on the cover last week said something about glorified Skype online, but it's certainly not going to be that way. Our faculty have risen to the occasion. I've never been at a place where the faculty had such dedication to the school and such energy. So that's exciting.
I know, I remember, I mean, just being back as a student myself in my first year MSW program, those professors that I learned so much from. My field instructor, I learned so much from. And those skills that I learned, they've carried me in the last 20 years, not just in social work, but in business. And I think sometimes people think, oh, your social work degree, you need to go into social work, but you can go into business or do other things as well with the background.
You're completely right. And I have another example, because when I led this big health disparity center at the University of Chicago, I wasn't even went to the meeting to plan whether the university was going to apply for this big pot of money, and I was just doing it to be polite. And when the scientists from genetics and from clinicians and pathologists, when they said who should lead it, they said it should be you, Sarah. And I was like, are you kidding? I mean, I'm a social worker, but the skills that I had really allowed me to make it work, because I think I jokingly said that group course I had when I was in the master's program is probably the best course I've ever had. You use the skills in so many parts of life.
Every day.
Yep.
Every day. And I know I use them in the business world with my business for the past 12 years. So absolutely. I mean, I know we've talked about, you know, the school kind of where I talked a little bit that I was there 20 years ago, and I'm sure there's some alumni that are on, and they were with me at that time. And, you know, the school has seen a lot of changes in the last few years. When I was there 20 years ago, we were ranked number 7. And I remember going into my internships and just feeling very proud of coming from a school that was number 7 at the time in the country. Like I said, there's been a lot of changes in the last few years. You know, what would you specifically like to focus on as our school embarks on its next chapter? I know we have wonderful faculty and staff, and I mean, but what would you specifically like to focus on as our new dean?
Well, you know, I've been on the other side of the country, and I've been lucky enough to have been at the number 2 and number 3 ranked, and then the number below us at South Carolina. So I've seen how others view our school, and it really is pretty poorly understood. So I think that what's happened is we've got wonderful research going on and wonderful teaching, but nobody ever puts it all together to explain it to the world, you know, to portray it at the world. So I think one thing we need to do is really redefine who we are. So when I first came, I was on a meeting and people were going in a lot of different directions. So I went on my other screen to try to figure out what the mission statement was. I was going to say boldly, let's just go back to the mission statement. And I'm flipping through and I can't find a mission statement. So apparently the mission statement, faculty were not terribly happy with it. So they waited for the new dean. Mm-hmm. And I think that's important, because I don't want to explain the wonderful projects we do and the wonderful courses we teach and the wonderful things we do in the community without saying it's because this is who we are and these are our values. So I need help from alumni to do that. The faculty is going to tackle this in the fall, and then I'm going to the Board of Counselors to get an outside view. But I think having both an inside view on it and then a view from outside the school would be very, very good. So this is my first mission. It's a little bit hard now. We had a faculty meeting with 100, imagine a Zoom call with 169 faculty on it. Everybody was like a little tiny postage stamp, but we will do it. We will figure out how to do it, because I want the world to know how good the school is, not only in this country, but elsewhere. We've been known as kind of shiny, but we haven't, I don't think they've realized completely our substance.
It's interesting. And I like what you touched on. It's something I was going to ask later, but I'd like to ask it now. You know, as alumni, what can we do to become more involved and support the school? I mean, because I believe the best social workers come out of USC. I mean, maybe I'm biased because I, you know, came from USC myself, but I believe that the best social workers come from USC. What can we do as alumni to be involved and to support the school?
Certainly, I like to hear from alum. Now, you know, there's an issue of capacity, right? Like how many emails I can answer, but I really do like to hear. And I think that getting involved in events like this is very, very helpful. We're going to be doing more things in the fall, and we're certainly when we're able to open up. So please come back and weigh in. I really you know the school in a different way. And it's very, very important, plus you've seen it over time.
Right. And I feel there are so many new things that the school is doing. I've been listening to the Listen Up series, the podcast. It's excellent. I don't know if anyone has listened to it yet. I would highly recommend it. But there are so many resources available that I feel that I didn't know about maybe 5 years ago. Whereas now I feel more recently, we're learning more as alumni, what is available, and with CEUs and just being involved. So I've seen that change.
And we really want to expand that, because I think that it sort of frightens me that you're trying to teach somebody to be a social worker in 2 years, basically. That's why I take every class session seriously. And because I think at the end, when I have given somebody a grade, I'm saying they learned that material, you know, and it's very important to me, because you're empowering someone to go out and work with, serve people who have a lot less power. So I think that lifelong learning is important too. And what I'm trying to get us to do is to offer more professional development programs. It's kind of hard to add that on, but we'll do it so that you can be lifelong learners, and you can, in so doing, help the school.
I absolutely agree. I was just talking to Amanda, and she was talking to us about a course that's going to be a semester-long course, and I thought, wow, I would love to do that. And, you know, for us as social workers to come back to USC and to be a part of that community again.
That sounds like fun. And
does that sound like fun? I want to do that.
Let's do it soon.
Yeah.
So one thing the pandemic's done just for the university as a whole is cause us to sort of rethink learning. You know, a lot of the way the university set up started in the 13th century. And the university hasn't changed as much as the rest of society. So Carol Folt, President Folt, has asked us to really think what education in our units like social worker might mean in the future, how we can do it in a way that best prepares people. And we hear from Generation Z, you know, they like stackable credentials. You know, they like to learn more things and be credentialed in a lot of things that involve social work. So maybe, you know, semester-long course is no longer really the way to do it. And with online education, we're also thinking about, do we really need this 50-minute hour or the 3-hour course? You know, might we be able to do modules? And so it's allowed us to think, I think, in new ways about social work education. So ideas on that from people who've been out in the world. I've basically been in a university for twice as long as you've been at your MSW. We won't go into detail, but you know, so hearing from people who are in different parts of the country and different aspects of their career is really helpful.
Well, and it's so interesting because I feel like we are able to connect. I mean, in some ways it is hard because we're separated, but we are able to connect. And even with the CEUs, I know doing them online, it makes it really nice for alumni to feel involved that way. President Folt, just hearing her talking with deans as well of the schools, I've been able to listen to her, and she's had a lot of podcasts and a lot of webinars she's done too. And I've definitely seen USC do more as well. I mean, I really have in the last, I'd say recently in the last year.
I hope so.
Yes, yes. Well, I do have questions from our alumni, if that would be okay, if I bring some of those out. I mean, I wish we were here sitting together, Dean Gehlert, and we could be talking, but you know, I'm just gonna read off some of these questions if that's okay as well. Sure. This was one submitted by a member of our alumni. Let's see, it says, I have a question regarding the future direction of our school. It seems to have lost some of its competitive edge in being a clinical training ground, especially in the curriculum for direct social work practice in mental health, and especially in comparison to other local MSW or MA training institutions. How will this be reinvigorated in the years ahead, and how will USC reclaim its previously high ranking and prestige as a sound training ground for clinicians? Great question. Great question.
Well, we need to sort of regain our position in many areas, but this is something that's faced academic social work around the country. And no school does it well. like no school has really figured out whether to be generalist, whether to have departments, whether to separate clinical from community policy. There's no really great way of doing it, but at the same time, as someone who's primarily a clinician, although I've never been able to do clinical work alone without knowing policy and systems, I take seriously that we're giving somebody a degree and they are dealing with people with psychological, with family problems. So I think that we might put together an advisory group to sort of figure out how to do that. One extreme, the University of Chicago before, and I don't even think they're even still doing it, but it used to be that if you wanted to be clinical mental health, you had to develop some depth in one clinical modality. The hard part, the thing that constrains us is the 2 years. Trying to do all these things in 2 years, and the Council on Social Work Education, which tells us the competencies that we have to help people develop, certainly weighs in. So it might be that if we can find these new ways of using modules and not being so completely restrained by the 3 hour a week courses, 3 hours in each course, we can solve some of these problems in a creative way. Did the person who asked the question have an idea?
They did not have an idea, but I thought it was a really interesting question because I remember I did stay at my nonprofit. It was my first year internship. I stayed there for 7 years, but I did interview at other places. And when I would interview, they would say I had good clinical skills. And I know it came from that foundation from my first year practice class, first year behavior class, and then also from my field instruction. So I remember that was really important with our field instructors that we had in place at the time. I remember one field instructor said, "Oh, we wear lots of hats as social workers." And I'm like, what does that mean? But you learn so much from your field instructors when you're actually out in the field with that direct practice.
I agree completely. I still am in communication with my field instructors. After all this time, we talk all the time. But the issue is trying to prepare social workers for all the possible jobs they'll have, all the possible environments in 2 years, and make sure they have enough depth, but still, some breadth. So we welcome ideas, but we are completely open. And we've got a few faculty like Devon Brooks who are just very creative thinkers who are helping. I've got a little task force of people who are helping think in new ways. Oh, I think I was just starting to read a comment and then it disappeared. It looked like they might have had a solution there.
Oh, that would be great. No, I know. And, like you said, you still talk with your field instructor. I do with mine too. And she actually texted me this morning and wished me well on our interview today.
So
I thought
really
that was
nice.
So I think that connection for our students is so important to have that important field, instructor. I have another question, unless did someone comment or let's see. I have another question from another member, another alumni. What advice do you have for an MSW graduate who came right out of school into this challenging pandemic climate? Wow. Yeah.
That's like the hardest question of all. I don't think there's a harder question. So we're trying to help people, link with possibilities. I'm not sure how different it is. You still have to find out what the positions are. Getting started, I can be empathic because I started a job where I've been to my office like once, right?
Right.
And I know most people from sort of the waist up, but not the waist down because everything's been on Zoom. I think you just have to have enough confidence in yourself to do it. People are still hiring. It's kind of interesting how some doors are opening. We got a grant proposal funded, which on a good day is difficult with the National Institutes of Health. And then they called and added 2 years to it. So we can't always assume that this is making things worse. It might in some ways open doors. I think it's literally just having enough confidence in yourself and using alumni context to try to find out where the jobs are.
I was just going to say that too. I actually had a student reach out to me recently, and I'm going to be talking to him tomorrow. And I feel like if our alumni know there's that connection with our students or recent graduates, we can help them as well. I mean, when I owned my business and I had 2 applicants and there was a Trojan and there was the other applicant, I would always hire the Trojan. And I feel we need to do that even more now. But I liked that question coming from.
There might be some way of formalizing more, where our alum are, and if they volunteer to help a student who's looking for a position, we could even categorize it by area or by, content.
Absolutely. And this happened to be a student who's interested in nonprofits. And that was the area that I was involved with and I'm still involved with. So it's a good connection. I really like that. And I think for alumni, we want to be involved that way. This is another great question. What is the role of social work and social workers during this global pandemic and civil rights movement? So I guess it's 2 questions. I mean, what is our role during this global pandemic that we are now faced with that we've never seen before?
I think with the pandemic, in both, we sort of bring an understanding of how social factors fit in, and also an understanding of community, back to when we were talking about when I was led that group at Chicago. I felt like I didn't know as much. I mean, I thought the rest were rocket scientists and I wasn't. But then one day somebody said to me, Sarah, you know community. You go out and you actually know how to talk to people and you understand their social lives. And to them, that was rocket science. So that was kind of an epiphany for me. I think that we have to help understand things like the contact tracing is not simple, right? And there are a lot of social factors that fit in, and especially for people who have reason not to want to be visible. We can interpret that. I think one important thing that we can do is interpret that. I got students at South Carolina involved in getting people registered for the census, because there were counties in South Carolina where people didn't like to necessarily be part of things. And they had, in the last census in the 2010, only had 40% of the county be enumerated. So I think social workers' skills are so important in these areas. It is rocket science. It can mean the difference between success and failure of these programs. In terms of civil rights, in terms of systemic racism, I've thought a lot about this. So there are different things that we can do. Certainly participating in marches, certainly, being involved. But also, I think as Research One University, it's really important that we help identify the root causes of what's going on. I think that over my few years in the business, I've realized how important informing policy is and trying to change policy. Sometimes when we go in and we haven't necessarily done all the homework, the changes that we make don't last. So I think that really trying to find the root causes of what's going on now can be an important contribution, and trying to change policy. So in terms of policing, for instance, it certainly is good to have social workers on the front line. Social workers have been for a long time. But I think that trying to understand some of the laws that have been passed when we weren't necessarily paying attention, that gave a lot of, that just weren't well thought out by people with a social work lens, that gave a lot of powers to people in law enforcement who at the same time were not very well trained. So my husband's a community psychiatrist, for example, and spends a lot of time trying to get police to understand how to de-escalate situations. So I think that social work involvement, it can be at multiple levels there, but certainly trying to use our evidence-based abilities to understand what works and what doesn't, and target. We know that when we're in clinical work, right, you want to really decide which intervention to use based on what's likely to build in success and what's likely to cause other things to change. So I think when we're working with some of the social problems that are happening now, doing it through that lens too, a very careful strategic lens is important.
Absolutely.
And we are trying to help our students be prepared for this world where they'll be questioned, a lot, and where everybody's nerves are on edge. Just trying to figure out, make some of the things that happen in the classroom teachable moments that can be used when our students go out into the world and where not everybody will agree with them.
Right, absolutely. And our professors, and drawing on their experience and their education, they can share so much with our students, so much. Here's another question that kind of goes along with what we were just talking about. This is another question. It says, considering the current state of affairs and the renewed spotlight on diversity, equity, and inclusion, how will you, specifically and outside of a diversity task force, commit to the work of race equity, especially as it relates to the school's leadership?
Well, I think that we need to bring in more diverse senior faculty. And that, I've been working on that for years with some success. What happens is you've got to make people feel like they will be welcomed at a school. Yeah. And it's really not, you can't just offer somebody a job and expect them to come. So we're starting something called Serenade, which has worked at other places where I've been. And basically just start talking to people who might want to come to USC and maybe don't understand it so well, and not do a hard sell necessarily at the beginning, but say, come out, meet our people, give a talk. And it might take 2 years to do this, but we will. And I think it has to go through the whole school. I remember one faculty member who was asked to give a talk at another school, and he went in the front door and he looked at the staff and he saw that they were not diverse, and he decided that was not a place he wanted to be. So I think you have to look at the entire school. And one thing we're trying to do too is train students from the very beginning. And I learned this, I talked to some of our current students about this, and start thinking now about yourself as a social worker, and what does it mean? And who are you, and how might you contribute? And what can you do to make things better? So we're doing a lot along those lines.
Wonderful, wonderful. I like what you said. It's like, what can we do as social workers? Think about yourself as going out, right? When you start in your MSW program, what you're going to do as a social worker when you leave this program. It's so true.
Instead of saying they should do this, they should do that, say, what should I do? Begin to think, what should I do?
Taking that ownership. I love that.
And
go ahead. Sorry. No, you go ahead. No, I'd love to. Did you want to say anything else about that?
I was just going to say, I think it's really important to include alum, to include students in forging the diversity future for the school. So we're trying to, instead of just saying who wants to be on a committee and let's meet once a month, what we're doing is we're soliciting self-nominations from students from different parts of the faculty, of the school, and asking them to self-nominate to be part of our equity, inclusion, and diversity efforts. And if there are, and I'm hoping, there'll be so many students and so many staff members who want to participate that we'll have an election. So the others in that area, so all the, let's say, the students in mental health, or no, it wouldn't be that. It would be like the MSW on the ground will look at the slate of people who self-nominated and vote. So everybody feels like they've had a say in what we're doing. And I think we can get a lot of new ideas that way. We don't want to do the same old and say, this is what we're going to do. What do you think about it? That's done too often.
Yes.
So,
that's why I love this question. It's because this person said specifically an outside a diversity task force, because I feel sometimes it's like, oh, we'll do this task force and we'll meet once a month, but is any real change going to come from that? It needs to come from within, from all of us. So
and we also need to be questioned. You know, we really need to be questioned. We can't be complacent. But I'm too far along in my career to want to be just having meetings to meet. You know, I really want change to happen.
Well, and I feel like, I mean, just getting to know you a little bit, you are reaching out with the students are reaching out with you. You have that communication and connection with them already. And you've only been here for a month. They
can be challenging, and that's good, because that's the only way things are going to change. And I appreciate honesty. I greatly appreciate input and honesty. So I've met with 2 groups of students this summer, and actually one had ideas about one of our courses. So I'm asking them to come to the first faculty meeting to talk about it.
I love that, because I mean, that empowers students. We're getting their point of view, and then also we can make change as well, the school can. So that's wonderful.
They've got good ideas.
They do. I have another question from another member of our alumni community. Here we go. What career advice could you give to someone who wants to pursue a career in social work education, and how should one go about it after earning their MSW?
To a career in social work education?
So she said, this individual says, what career advice could you give to someone who wants to pursue a career in social work education? And then, so how should one go about that after earning their MSW? So I guess if someone wants to go into social work education, how should they do it after earning their MSW?
I suppose you could do it in 2 ways. If they mean teaching at a university, do you think that's what is the person on the call?
I think so. I think that's what they must mean, because probably as a social work educator, that's what their question says. Yes.
Yeah. So
yes,
there's formally and there's informally. So you certainly can educate about social work at different levels. If they mean at a university, you know, either one that has undergraduates, masters, or PhD, or all 3, you pretty much have to get a PhD. And I think there, it's just trying to find the place that where faculty reflect what you want to be. And certainly it's got to be a really good fit. And it's the hardest thing I always ask people, what do you want to be doing in 10 years? You know, if it were everything, all the stars had lined up and you're exactly where you wanted to be, what would it look like? And then say, let's work back from there. You know, what would that take? So sometimes the hardest thing is just trying to figure out exactly what you want to do.
And I'm even thinking of going into social work education. One way to do it too is even as the field instructor. I know there's training. You are teaching as a field instructor as well. I was fortunate enough to do that at the nonprofit I worked for, and I really enjoyed it. So I know that's a way of something you want to do as far as education, social work education, that's a way to do it too.
No, that's a good idea.
This is another one. This is another question from another, let's see. How can the separations between concentrations be decreased for a more holistic micro, meso, and macro education?
That's again, I talked about this a little bit earlier. It's really tough because you want people to be prepared in one area, but you also want them to be aware of, to be trained well enough in the other areas. So I think probably, again, when I advise students, now I can't because I'm the dean, but when I did advise students, I again would say, what do you want to be when you finish? I mean, again, what would be the ideal job? What would make you thrilled? And then let's think what courses you need to be there. You know, what would that take? So if, for instance, you wanted to be in maternal and child health, and you wanted to be a clinician, but you wanted to be able to sort of, you know, become a supervisor and have some administrative duties, you'd need to learn something about health services. You'd need to learn something about the system. You'd need to learn clinical skills. And you'd need to maybe learn a little bit about management. So really, I would like to move to that kind of system where it's a little bit more fluid, where you don't have to just sort of put yourself in one area from the beginning, where you can have exposure. Okay. I'm just reading. The questions are so good. I'm sorry, I keep reading them.
Let's see. Let's see if there's a, let's see. I know there are a lot of excellent questions. Let me see if there's any more that have come in.
You choose.
Let's see. Okay. Let's see, social work. Okay. No, this has been wonderful. I mean, I've had so many questions come in from so many different alumni, and we really appreciate hearing from them. I know we talked about it earlier a little bit about, you know, where we were when I was there 20 years ago and where we are now, and you've talked about goals for us for the future. And you did touch on this. It sounds like the alumni, how we can get more involved is, I guess, reaching out. I mean, reaching out to Amanda. I know you're here, and reaching out to the alumni. And, I mean, is
Put
that
your number up, Amanda?
what can we do? So because I've been on different calls, and I feel like the alumni really want to have their voices heard and, you know, be involved. But we also, I feel, have a role with the future social workers. We do have amazing students that come out of our program with the MSW degree. So is there anything else you can think of that we can do as alumni to support the school? Because you're one woman, and I know you're going to do a great job, but we want to be behind you.
No,
and
honestly,
help you.
I am someone who welcomes perspectives, different perspectives and ideas. So Amanda, I think, has some ideas. We already have a way of linking students with alum, but ideas for broadening that. And I think bringing more alum in to talk to students is really valuable too, because they're imagining what it will be like, and you all know what it will be like. You can tell them, and you can give them ideas and say, I wish I had when I was in school, or I'm glad I did. That's invaluable. So if we could do we have a series, Amanda, where we do that?
Yeah, actually, this great segue, and Kristina's part of it. This fall, we had plans for it in the spring, and then, you know, everything happened, but we're going to have it completely virtual now with social work sessions, and I'm finalizing all the details for this fall. I think off the top of my head, we've got about 8 alumni on Mondays and Wednesday evenings for our students in various different backgrounds, whether it's, and I actually see a couple of them on the phone call. So Dan, we're looking forward to having you here on talking to our students, but it's exactly what, you know, you guys were talking about. We want the students really see what it's like to be a social worker in the various fields. We've got a medical social worker, we've got folks working in the nonprofit, we've got folks working in private practice. I mean, just a slew of alumni, both recent and farther back. And so if you're on this call and that is something that interests you, and you want to do an hour with our students, please I'll put my email in the chat box, so please feel free to reach out to me personally. We're full for the fall, but I'm booking for spring. So great segue. And I will add, and we have a platform, like Dean Gehlert mentioned, Dworak-Peck Connect, where we really try to do these matches. Kristina mentioned she was going to be talking with a student. We did that match on Dworak-Peck Connect. So if you aren't signed up for a profile, I call it the LinkedIn of social work, but it's specific to our social work and nursing community. So it's our alumni, our students, and some community and friend members who, you know, are out there making a difference in the field. And this is really where our students, because alumni can't reach out to students, it has to be students reaching out to alumni. So if you've been getting messages from our students, please respond. You know, they want to hear from you, and we really want to make this an engaging and robust platform. We're putting our webinars up on here. We're offering continuing education resources, our ASW supervision list, so exclusive to Trojan alumni. So if you're looking for a supervisor for your hours, which I know a lot of you are, we're housing that exclusively on Dworak-Peck Connect because we want it to stay exclusive to you guys. So great segue. And yes, we have lots in the pipeline and the plan, and I will put in both the link to Dworak-Peck Connect to sign up. You can easily input your LinkedIn profile, and I will put my personal email. Please feel free to reach out to me anytime through email. We can easily hop on a Zoom call or whatever the case may be, because like Dean Gehlert said, I do like hearing from alumni too.
Yeah, and blow their mind, blow the students' mind with what you're doing. I mean, expand their horizons of what social work is. I think that's important too. When we say health social work or medical social work, that can be 600 things, you know? So anything interesting, unique you're doing too, or if it's not interesting or unique, but just darn good, I mean, they need to really hear about it. So that's an important part of their learning, I think.
Well,
do you have any more questions, Kristina?
No, I've asked all my questions. I wish Dean Gehlert and I were here together, and I hope that we can be together soon in person. But I would like to thank the alumni for being here today to connect with our new dean. And thank you, Dean Gehlert, for talking with me today, for your honesty and for your openness. I really appreciate it. It means so much. And I'm looking forward to all the great things that are to come with you as our new dean of our school.
Thank you. So you're a very good interviewer too, by the way, Kristina.
Oh, thank you. Thank you. You make it easy, and it's just been so wonderful to get to know you. I'm very excited about what's ahead with you as our dean.
Thank you. Thank you all.
And thank you. That, I will close it out, and thank you, Kristina. Thank you, Dean Gehlert. And as we like to say in our community, fight on, everyone. Have a wonderful day.
Thank you.
Bye-bye.
Bye.